Hello friends. This is Dr. Benzo Day and I'm back with a new video and today we will talk about lesions of the palate. तो हमारा पहला lesion है हमारा पेटिकिए. नाम में ही है पेटी मीन्स लिटिल मीन्स इन्नूसा. So these are seen in infectious mononucleosis. Then we go on to vesicles. Vesicles in the posterior part of the palate are seen in herpangina. So P for palate, P for posterior and P for herpangina. Then ulcers. Ulcers in the form of a crater are seen in necrotizing cyanometaplasia. So cr and crow. So these both are matching. Then we go on to papule. So these are seen in diarrhea disease or keratosis follicularis. Garopapse. So friends, it is very easy. Then we go on to necrotizing cyanometaplasia. It mimics carcinoma clinically. There is a large palatal ulcer which is also known as crateriform ulcer. It is more common in males who have aged more than 40 years and the cause is smoking. जो smoking होती है उसकी वजह से heat जो होती है it leads to ischemia and necrosis and which leads to ulcer. And also there is metaplasia. There is squamous metaplasia of the ducts and in the gland. But when we perform biopsy there is no atypia. There is only pseudoepitheliomatous hyperplasia. That is the rete ridges are present at different level but the basement membrane is intact. Then we go on to diarrhea disease. Diarrhea disease is due to ATP2A2 gene mutation or a calcium pump mutation. It also occurs due to vitamin A deficiency. Now D for diarrhea and D for dominant. So it is autosomal dominant. It shows intraepithelial clefting like pemphigus and the dyskeratotic cells in diarrhea disease are known as corpse, rons and grain. It shows acantholysis just like pemphigus. And the oral manifestation of diarrhea disease is a shiny papule. डरो पाप से. So दोस्तों it is very easy. जो हमारा पैलेट होता है उसको हमको दिखता है पेटी के, वेसाइकल्स, अल्सर और पैप्यूल. So पेटी के में पेटी means little innusa infectious mononucleosis. Vesicle in the posterior part, herpangina. Ulcers in the form of a crater in necrotizing cyanometaplasia. And papule on the palate. A shiny papule on the palate is seen in diarrhea disease which is also known as keratosis follicularis. Then necrotizing cyanometaplasia, it mimics carcinoma clinically but it is benign. In biopsy there is no atypia. There is only pseudoepitheliomatous hyperplasia. Diarrhea disease, D for diarrhea, D for autosomal dominant due to ATP2A2 gene mutation and vitamin A deficiency. Shows intraepithelial clefting just like pemphigus and the dyskeratotic cells are known as corpse, rons and grain. Oral manifestation is on the palate a shiny papule. I'm hopeful friend this video is helpful for you. Thank you.